Aortic aneurysms are referred to as silent killers, since they pose a risk to your life with little to no prior warning. Albert Einstein, Lucille Ball, George C. Scott, and John Ritter all share a common trait. What is it their connection? All of them passed away due to aortic disease. Both Einstein and Scott were diagnosed with abdominal aortic aneurysms, whereas Ritter and Ball were diagnosed with aortic dissections for their conditions. The incidence of aortic aneurysms in the United States has tripled in the past 30 years, most likely as a result of the increasing number of elderly individuals in the population. Ruptured aneurysms are responsible for the deaths of more than 15,000 people each year. When it comes to men over the age of 60, abdominal aortic aneurysms are the third largest cause of sudden death. Because patients frequently do not experience any symptoms until their aneurysm ruptures, aneurysms are frequently referred to as a silent killer. Because the disorder is responsible for the death of over 75% of all patients who have a ruptured aneurysm, screening is extremely important for those who are at the highest risk. Aneurysms. All of the arteries in the body are susceptible to developing aneurysms, which are characterized by a weakening and ballooning of the arterial wall. It is possible for an aneurysm to rupture, causing internal bleeding, shock, and even death if it expands to a large enough size. In the aorta, which is responsible for transporting blood from the heart to the various organs throughout the body, aortic aneurysms can develop. Aneurysms of the thoracic region are those that develop in the portion of the aorta that is situated in the chest, whereas aneurysms of the abdominal region can develop in any part of the abdomen, including the kidneys and the intestines. Your aorta is a huge blood channel that is both muscular and elastic, and it is responsible for transporting blood and oxygen from your heart to other various sections of your body. The ability to expand is essential for it to be able to deal with the high volume of blood that is being pumped out of the heart. It's very similar to a balloon. When the vessel begins to lose some of its elasticity, this might lead to the development of an aneurysm. In the weak spot of the vessel, this results in the formation of a bulge. In most cases, the breadth of the aorta is significantly less than 3 centimeters. When the size of a bulge reaches 5.5 centimeters, there is a possibility that it will rupture. An aortic aneurysm that has ruptured poses a significant threat of death. There is a 50% chance that a rupture will result in the patient being transported to the hospital alive. Of those, just 50% will be able to make it to the operation room. To a lesser extent, the patient will emerge from the operation room. After then, 50% of those individuals are able to return home. There are symptoms of an aortic aneurysm. The majority of aortic aneurysms are discovered either by chance, while checking for another issue, or the majority of them are discovered through screenings. The symptoms are typically modest and unnoticed, however they may include the following. Symptoms such as trouble breathing or shortness of breath, being able to feel full without eating a lot, discomfort at the location of the aneurysm, complications in swallowing, arms, neck, or face that are swollen in appearance. However, it is not until the aneurysm ruptures that it becomes apparent that there is an issue. At that moment, it is a major medical emergency that requires treatment to be administered right away. It is possible for a rupture to create such excruciating agony in the back or abdomen that it causes you to pass out. Dangerous factors. For men in particular, smoking is the most significant risk factor for developing an aortic aneurysm. A one-time ultrasonography screening is recommended by the United States Preventive Services Task Force for any guy between the ages of 65 and 75 who has smoked. This recommendation is based on the fact that there is such a high association between the two. On the other hand, recommendations for lung cancer screening are based on the amount of smoking history, which is a significant departure from this circumstance. Your smoking history is the one factor that matters when it comes to aortic aneurysms. Among the additional risk factors are, males are at a much higher risk than females, regardless of whether they are 65 years old or older, have high blood pressure, high cholesterol, or have a family history of aortic aneurysms. Dissection of the aorta. The formation of a tear in the innermost lining of the aorta wall is the first step in the process of aortic dissection. As a result of the tear, blood begins to seep into the aorta wall, which ultimately results in the separation of its layers. Because of this, the aortic wall is subjected to severe pressure, which leads to an increased risk of rupture. In addition, aortic dissections have the potential to restrict blood flow to a number of vital organs, such as the heart, brain, liver, kidneys, intestines, spinal cord, and legs. The dissection of the aorta is a life-threatening emergency that frequently results in death. Evaluation of the aorta. It has been demonstrated that the early identification of aortic disease can save lives. The treatment of individuals who have aneurysms and the implementation of preventative screening in high-risk patient populations have both contributed to the annual saving of thousands of lives. The treatment for aortic aneurysms is unknown. A piece of the aorta that has been injured is removed by the surgeon during an open aneurysm repair procedure. The damaged section is then replaced with a graft, which is a synthetic blood vessel. The repair should be permanent, which is a benefit of the treatment, especially for younger patients. This is especially applicable to younger individuals. On the other hand, it is a more invasive procedure that requires a larger incision to be made in the abdominal region and a longer period of time for recovery. The most prevalent type of surgical procedure is called endovascular aneurysm repair, or EVAR for short. The wall of the aorta is strengthened with the use of a tiny stent graft, which is a treatment that is considered to be minimally invasive. In order to access the location of the aneurysm, your surgeon will make a small incision in the groin that will allow him to thread a thin tube, known as a catheter, into your arteries. One of the most significant benefits of the surgery is that it offers a simpler recovery process, typically requiring only a couple of days in the hospital. One of the drawbacks of the stent is that it needs to be monitored on an annual basis and will most likely require a reintervention between 5 and 10 years from now. In conclusion, aneurysms are a serious and often silent threat to our health. They can develop without any noticeable symptoms and become life-threatening if they rupture. Understanding the risk factors such as smoking, high blood pressure, and genetic predispositions is crucial for prevention. Regular checkups and a healthy lifestyle, including a balanced diet and regular exercise, can significantly reduce the risk. Early detection through medical imaging and timely intervention can save lives. Stay informed, stay healthy, and take proactive steps to protect yourself and your loved ones from this silent killer. Was this video helpful? Let us know in the comments below. If you enjoyed watching our video, then hit that subscribe button now to watch more of us. Thanks for watching. See you in the next video.